So what has the impact been of this change? So, of course, it's hard to say. It's still pretty new, but here's what we know so far. Understanding the changes and the pre-November 15th and the post-November 15th and what modifications can be made and what modifications can't be made and et cetera, has been very challenging, as anybody who's tried to read the November 15th policy update knows. Many questions have been raised. The answers have been unclear in many cases regarding, for example, what has to go into an EUA submission for an LDT, as well as what modifications need an EUA submission or an EUA amendment. FDA has, to some extent, addressed these questions during its virtual town hall meetings, which have occurred biweekly since the start of the pandemic. So they're up to almost, I think they've held 80 in the past 2 years. The last two have focused on the November 15 policy largely. And it's also possible to submit questions to the EUA request mailbox that FDA has. Response times to submitting these questions has been variable. And there's lots of unknowns at this point. As I said, the deadline for submitting EUAs has just passed. How many were submitted is unclear. How many labs that were offering LDTs did not submit and presumably will stop offering their tests is also not known. What the review times for all these submissions that FDA has called for is not known. How many FDA will view as meeting their prioritization criteria and their substantive review criteria, also unknown. One interesting factoid, although I'm not sure what we make of it, but it is interesting, is that prior to the November 15 policy change, FDA had authorized about 420 COVID tests total, and only about 25 of these were LDTs. And I think there's likely a number of reasons for that, but it will be interesting to see what the proportion of LDTs authorized post November 15th is compared with IVDs.